Welcome. My name is Melanie, and I'd like to talk to you guys about D to B. D to B is door to balloon times. According to Park et al., door to balloon times are in place to improve patient outcomes for those who are receiving PCI. PCI, according to Dye et al., is the preferred strategy for reperfusing the heart for a patient who is having a STEMI or ST elevation myocardial infarction. Some of you may know this as a heart attack. Case scenario: patient presents 88-year-old in his home having chest pain, shortness of breath when he ambulates. The pain is radiating down his left arm, his jaw, his neck, and his back. He sits there for a while thinking that the pain will go away, and it doesn't. So he ends up calling EMS. EMS arrives at his home. He presents them with the symptoms. They proceed to do a 12-lead EKG, which does show ST elevation in two continuous leads. They call the hospital and let them know what the symptoms are and what the EKG says, and the hospital prepares the patient to go directly to the catheterization lab. This is so because evidence has shown that getting these patients to the cath lab reduces ischemia to the heart, thereby improving the patient's outcome and decreasing muscle damage to the heart. The time is, if the patient is going to a hospital that is capable of doing a PCI, which is percutaneous coronary intervention, which introduces a balloon angioplasty into the arteries to open it up, or a stent to open it up and improve blood flow and reperfusing the heart with blood. They would like to get to the patients to the cath lab within 90 minutes if the hospital provides that type of service. If they're going to a hospital that doesn't provide this type of service, then that hospital may start the patient on a fibrinolytic such as heparin or some other in that class of drugs that's going to thin the blood in order to reduce the ischemia until they can get the patient to a hospital that does provide those services. When the hospital gets in touch with the hospital that they're going to transfer him to, they consult and decide that the patient is going to transfer there. Then they get the patient to that hospital, and they would like the balloon time to be 120 minutes from the time the symptoms were presented. If you go into a hospital that provides these services, then you get 90 minutes to get them to the balloon. Now, when they're introducing the balloon into the artery, this is done so through a catheter, and they either go through the radial site in the wrist or the femoral site in the groin. And the patient is either put in a stent or a balloon. It opens up the vessel, and they should no longer be having the chest pain. So after the procedure, chest pain is abnormal, and we must respond immediately to chest pain and getting another EKG and getting the patient the care that they need. Now, reaction time needs to be pretty quick because the heart is a muscle, and damage to it can cause it to be less effective as a pump throughout the heart. Some risk factors for myocardial infarction include smoking, hypertension, high blood pressure, high cholesterol, diabetes, and advanced age. High cholesterol, you have these plaques, atherosclerosis that causes buildup in those arteries, which make it less narrow for the blood to be able to get through, and you can have areas where the blood can't get through at all. This is where the ischemia occurs, which is where the patient feels the pain. Diabetes is another one, that you have glucose that is deposited in the arteries, and it gathers up and accumulates until there's nowhere for the blood to go through as well. Smoking constricts the arteries, so you have the lack of blood flow, and as they age, the arteries just become less elastic and have less recoil in order to get through. So our patient, he has diabetes, is pretty much under control. He hasn't smoked in years, but he did have a remote history of smoking. He's pretty sedentary. He doesn't get out and do any type of activity often, and he is 88 years old, which we will consider that as advanced age. All of these are risk factors that put him at risk for this myocardial infarction. Now, he also is on a medicine called atorvastatin, which is for high cholesterol. That puts him at risk as well. Now, we talk about modifiable risk factors, and those are his sedentary lifestyle because he can get out and exercise. His diabetes, we can get it under control, and his hypertension can be reduced with medication. Now, his advanced age would be a non-modifiable risk factor because we can't change his age and we can't change his genetics. So, getting the patient to the PCI lab in 90 minutes has been proven to effectively improve outcomes according to Park and all. We do want to make sure that nursing assesses the patient after the procedure because we want to monitor and make sure that they're not going hypertension, that they're not getting bradycardic, they're not going into any type of heart block. We want to make sure no lethal rhythms are happening for this patient. And one of the big items that we want to watch for is hemorrhage because we have gone into an artery and the patient is being monitored for that. So we want to make sure we're looking at the sites, we're checking their vital signs because one of the earliest indications that a patient is hemorrhaging is the blood pressure dropping or hypotension. So we want to make sure that we're thoroughly looking at their blood pressure and making sure that their heart rates are under control. We want to make sure that the patient is also medically managed after the procedure with aspirin. They're usually placed on Plavix as well as a beta blocker that improves the heart rhythm and also a statin that helps with that cholesterol. We want to make sure that they're on the appropriate medications for their diabetes. We want to make sure that we're providing them with smoking cessation education, taking care of their sites that were used for the PCI. We want to educate them on just generally taking care of themselves, getting out and exercising so that we reduce the incidence of this happening again. Education plays a very important role. Nurses make sure that the patients are educated each encounter that we meet with them, and as well as the physicians provide education. We do have a program called cardiac rehab where the patient is followed up several times after so that they can know when to resume exercise. They are well educated on their medications, any adverse reactions that they need to be looking for, what to look for if this were to happen again, how they're to take their nitro, when to come back to the emergency room, when to call 911. All of these things are educated on in order for the patient to be successful in reducing ischemia to the heart again. PCI has improved patient outcomes, and no matter what age the individual is, and time is always of the essence. So we want to make sure we get these D to B, door to balloon, in 90 minutes, or D to B in 120 minutes if they're being transferred to a facility that does require this procedure. I want to thank you for listening. And if you have any questions, please let me know.